5 years after the outbreak of deadly COVID-19 pandemic that caused over 7 million deaths globally, China is now reportedly seeing a surge of human metapneumovirus or HMPV. HMPV is a respiratory illness with symptoms related to those of a flu. This has sparked serious concerns over the health crisis after COVID-19, prompting neighboring countries to monitor the situation closely. Several media reports and social media posts suggest that the virus is spreading rapidly in the country. Some even claim that hospitals and crematories are being overwhelmed. As respiratory illness increases in China, there are complaints of congested hospitals and overburdened healthcare systems. Some social media users claim that multiple viruses including influenza A, HMPV, mycoplasma pneumonia, and COVID-19 are circulating in China. There are even claims that China has declared a state of emergency. However, there is no official confirmation. Although social media reports describe a critical situation, neither Chinese officials nor the World Health Organization has declared a state of emergency at this stage. First identified in 2001, HMPV belongs to the Pneumovidae family, closely related to the respiratory syncytial virus. It affects the upper respiratory system but can sometimes cause lower respiratory infections. HMPV is more common in winter and early spring. However, in younger children, older adults, and individuals with weakened immune systems, HMPV can lead to severe complications. The US Centers for Disease Control and Prevention notes that HMPV infections have an incubation period of 3 to 6 days, and symptoms may progress from mild cold-like conditions to serious respiratory distress. While HMPV and the COVID-19 belong to different viral families, they share striking similarities. Both primarily target the respiratory system, causing mild to severe infections. Spread occurs through respiratory droplets on contact with contaminated surfaces. Fever, cough, sore throat, wheezing, and shortness of breath are common. However, the main difference between HMPV and COVID lies in the vaccination. While effective vaccines exist for COVID-19, no vaccine is currently available for HMPV. Besides this, antiviral treatments are limited for HMPV, unlike COVID-19, which has treatments like Paxlovid. How to prevent HMPV? Wash hands regularly with soap and water for at least 20 seconds. Avoid touching the face with unwashed hands. Maintain distance from people showing sign of illness. And finally, clean frequently touched surfaces.